I've had some questions on social media about dissolving dermal filler. Most fillers are made of hyaluronic acid, and that's a naturally occurring sugar gel molecule. We have it in our skin giving nice plumpness and hydration. We have it in our eyeballs like the jelly. We have it in our joints providing lubrication and support. And every day our body breaks down about a third of our hyaluronic acid and makes more, and that process constantly renews itself. If you see hyaluronic acid in a serum or a skincare product and you apply it on the skin, it'll give some moisturizing and hydration for a couple of hours. But if you take that same molecule in a lab, you cross-link it, which means you make those little strands of spaghetti look more like ladders, then by injection that product can last 12 months or more, and in some studies we know can last up to a decade or more. Ideally seek the expertise of a medical practitioner who's a doctor, dentist or nurse who's very well versed in anatomy and knows which product to choose, where to put it and how to carefully place that to give you the best result. We all know complications happen even in the best hands, so there are situations where we always want to avoid getting that filler into a blood vessel, because if it blocks a blood vessel it can damage an area of skin that blood vessel is supplying, and in incredibly rare situations it can cause visual damage or skin tissue loss. So we want to be really careful where we're injecting it. I'll often use my ultrasound device and I'll scan an area to look at the depth of those blood vessels, because there is variation between different people and they can be at different depths or in different placements. We also want to see other products that might be in there from a previous injection, or if somebody's had scarring, it can affect the anatomy or the blood supply. So number one, we want it to be placed correctly. If that filler inadvertently gets into a blood vessel, you'd expect to see blanching, and that's why the whole face has to be squeaky clean, so that if you're injecting down here, you can see the course of the blood vessels following the whole pathway of that blood vessel. So if that happened, you would stop injecting immediately, and then there's a prescription-only medicine which is called hyaluronidase, and that can only be administered in Ireland by a doctor or dentist. We keep a plenty supply of this. We always label it because we hope to never use it, but essentially it's a prescription-only medicine, and it's an injection that we mix with a little bit of salty water and some pain relief, and that's injected at the depth where you've placed that filler, and you're aiming to clear that product and dissolve it. So you mix up that medicine and you inject it in that area, and within about 10 minutes a lot of those ladder bonds are broken down and the hyaluronic acid is cleared by your body, and within 24 to 48 hours that product should be cleared. Now that's assuming it's hyaluronic acid, because some other injectables are not hyaluronic acid and may not be amenable to dissolving. The other really interesting product I've seen lately and I've tried in the clinic is a topical medicine, so one that's applied onto the skin and not injected, to try and correct little tiny areas of filler if somebody's had some placed, for example, a little bit too much under the eyes or sometimes a tiny bit above the lip. So it's really not suitable for big areas, it's really for those tiny areas of correction that somebody might need to have. And this medicine is in a bottle, and we press this down and activate it and put the lid on, and then the product is dispensed in a gel and it's massaged quite vigorously into the skin for about 5 minutes. So for some people that can be a good solution. Number one with any dermal filler treatment is really seek a very experienced medically trained practitioner who's going to know their anatomy and get the product in where you want it, get you the results you want to achieve, and do that as safely and carefully as possible. Ideally, don't see somebody who's not medically trained, because they just can't pick up those skills in a couple of days course, and then you run a higher risk of complications. It's not about competition, it's really just about safety with your face in the right hands. All practitioners who are medically trained will be on the lookout for those rare complications. Number one is preventing them, and number two is knowing how to manage and diagnose that appropriately and treat it appropriately. And that's where the dissolving medicine like the hyaluronidase can come into play. And then the other situation is if you've achieved a poor aesthetic result somewhere else, you may be able to seek advice from your medical injector to help dissolve and clear it. So I hope that's helpful, and feel free to get in touch if you have any more questions. Take care. Bye.